Welcome to our Axios Pro Health Tech virtual event. I'm Sarah Pringle, Axios Pro Health Tech reporter, and I'm coming to you from Prescott, Arizona. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. Join the conversation today on Twitter with @Axios Pro and hashtag Axios Pro. Today, I'll be joined by Everside Health's Chief Executive Officer, Chris Miller, for a conversation on deal making and disruption across the primary care and value-based care landscape, as well as how his Denver-based company is looking to stand out from the pack. And now I'd like to welcome the CEO of Everside Health, Chris Miller, to the program. Welcome, Chris. Thanks for being here.
Delighted to be here. Thank you, Sarah.
Well, let's jump right in. Lots to talk about. So the last several months, of course, we've seen a number of fallen angels in the public markets and healthcare. And we've more recently seen an uptick in M&A in and around value-based care and primary care, the intersection at which really you play. There's Amazon, One Medical, of course, CVS, Signify, perhaps CVS, Cano coming soon. So what is all this activity reflective of, in your view? Is Amazon buying One Medical a watershed moment for primary care?
Yeah, look, we think the activity in this space is really good for Everside and frankly good for patients across the United States. I think all of this brings a lot of attention to the results that can be driven through value-based care. So we think that Amazon's acquisition of One Medical just continues to provide education for individuals, clients, people across the country about what can be produced through value-based care and how differentiated it is from fee-for-service. So we continue to like our position at Everside and think it continues to remain strong. And so again, we love the fact that more individuals and clients and frankly some big retailers and payers paying attention to the results that can be driven through value-based care. So we think all of this is really good for Everside.
So does this influence how you think about your strategy? Correct me if I'm wrong, but a lot of people put you in kind of the same camp as One Medical. How are you different? What are you doing the same? Are you competing?
Yeah, I think the One Medical does a great job, right? And so they serve clients and patients well across the country, but we think we're differentiated really in three primary ways. So the first is the size and scale that we have. We have nearly 400 health centers across 34 states, and that gives us a pretty unique advantage to continue to serve patients and clients in concentrated geographic areas, but also to serve big companies that have patients across state lines. The second is really the results that we drive. So we love the fact that we continue to drive results for patients and clients. We have a climbing patient satisfaction score. Our NPS is currently around 86. We deliver better than 90th percentile in terms of the client clinical results, and we're saving our clients a lot of money. So 17% by year 3 and 31% by year 5. So those are real differentiators for us, and we think that will continue here as we continue to focus on clients and patients. And the third differentiator is really the types of clients that we serve. It's a big difference. So we really focus on mid-market municipalities, unions, manufacturing companies, school districts. These are clients typically serve that really desperately need to save money on healthcare. So it's for them, it's a need to have versus a nice to have. So our client makeup is quite different from One Medical. And we want to continue serving that population that desperately needs better healthcare.
Great. So we've seen payers make a big push into primary care, value-based care. Now we're seeing e-commerce and traditional pharmacy players increasingly step up. I guess part A, do you expect this M&A frenzy from driven by these strategics to continue?
Yeah, I do. Again, I think there's been a lot more education around value-based care and again, what can deliver. So I think the large payers, the large retailers all want to play in the space and recognize the value that drives. So we think there will be continued activity in this space. And look, we're always open to listening to potential partnerships and aligning ourselves with partners that will allow us to deliver the best possible care and impact more lives. That's really what we want to do at the end of the day. But we think the entire U.S. healthcare system needs to continue to be disrupted. And so this is I think, a step in the right direction.
So what about hospitals and health systems? They need to accelerate their efforts in value-based care too. Are they the next buyer of a primary care company? Or is it a little early for that still?
So like we have some strong partnerships with hospital systems, but they're really regional, right? And so for a hospital system to think about acquiring a value-based care provider, I think they would need more of a national focus and a national strategy. We love the ability to partner with a few of the health systems on a regional basis, but it's really to serve the commercial population and continue to impact lives geographically. So I don't think they'll be the natural buyers of value-based care providers across the country, but I think there'll be a lot of partnerships.
Okay, because they need more of an incentive, right, to accelerate the adoption of value-based care. What will incentivize them?
Look, I think they're recognizing the value that's driven there too. So we're seeing a number of hospital systems create their own value-based care strategies, and so they may just try to do it locally or partner with those the value-based providers that I mentioned before. But look, I don't think there's any disputing the fact that value-based care is just driving better results for patients, better health outcomes, and better patient satisfaction. So I think that every U.S. healthcare entity is going to look for a way to play in the value-based care space.
Great. So let's talk a little bit more about Everside and what you're up to. You guys originally filed to go public in mid-2021. This summer, you called off the IPO. I imagine you're pretty happy with that decision, given the environment. To what extent do you think you're at an advantage today over your public market peers? Tell me when you made that decision too, to pull
Yeah,
IPO.
We got close to making the decision to go public, but in the end we decided to pivot and move to a different strategy because it wasn't the right fit for Everside. Everside, we're fortunate, we're a company that really doesn't need to be public. We don't have a lot of capital intensity in terms of getting clinics up to speed quickly and getting those clinics profitable. We have a unique advantage there. So for us, it was really opportunistic to take the company public, and the market started to turn in a different direction in terms of the value-based disruptors in the market and how they were being valued. So we pivoted and raised the private round and had great success in doing that. But we will remain open, I think, to the public markets in the future. If that's the right option for us to continue to impact lives and create shareholder value, we'll certainly consider that. But the private raise was a much better option for us. And look, I'd also say we love the focus on profitability now in the public markets. There seems to be much more attention paid to getting to profitability and getting to profitability quickly. That wasn't the case a couple of years ago. The markets were really focused on revenue growth and top line growth. We are very close to being a profitable company, and we will continue on that path. And I think that also gives us a pretty distinct advantage in terms of some of those bigger public companies that are losing, frankly, quite a bit of capital.
I mean, going off that point, when do you expect to reach profitability? And, you just raised $164 million. Are you doing specific things to reserve more cash than you would have done a year and a half ago?
Yeah, look, I think cash preservation is important, but so we're going to continue to be opportunistic in terms of how we spend those dollars. But we expect to be profitable in the next 12 to 18 months. And we are very intentional about getting there and getting there as quickly as we can. We certainly don't want to sacrifice the growth of the business, but we're using those dollars to spend money on technology. We want to be open to additional M&A, but most importantly, we're using those dollars to continue to build health centers, right? So we have a number of clients that are asking us to build health centers and get those up to speed and up and running quickly. So that's a great use of capital for us because it allows us to impact more lives.
Would you re-explore an IPO next year, or are you trying to wait till you reach profitability?
Look, I think it'll really be market dependent, right? And so if the markets are more receptive, a year from now, we'll certainly be open to that. that will allow us to be much closer to profitability, or maybe even profitable when the markets open up. But I think, I unfortunately don't have the crystal ball. I don't know if you do, so I don't know what the market's going to do in a year from now. There's a lot going on in the world these days. But the pivot to raising a private round was a great move for us, and it gives us, frankly, the ability to be really well capitalized in this space and play a bit more offense than defense.
So let's talk about other liquidity options. In the wake of Amazon One Medical, I imagine you've gotten a lot of inbound interest. To what extent are strategic buyers calling you up and with either interested in buying you or partnering with you or learning about you?
Yeah, so look, we've gotten a lot of inquiries, and I expect everyone in the value-based care space has too. And again, we have a pretty unique advantage in terms of the size and scale that we've got across the country. So we will be open to those types of partnerships. For us, it's really thinking about the best way to develop commercial partnerships right now. So we're exploring a number of opportunities with larger payers and even a few retailers in terms of how we can develop commercial opportunities together. But we are in no rush to certainly to sell the business. We love our position, and frankly, we think the best opportunity for us is to continue to grow and partner with the right partner with the right constituents, and then impact more lives across the country. There's 110 million Americans that get their insurance through self-insured employers right now, and we're serving 1.6 million eligible lives. So there's a lot of room for us to continue to grow, and we think every American needs this type of service. So that's our intention.
So let's talk a little bit more about that vision. Yes, you do primary care, but you do other things too. And in the past, you've kind of spoken about what you call the total cost of care solution. Where are you today? How do you get there? And tell me really what that means in your mind.
Yeah, so look, we would love to be a one-stop shop for our clients. So we built this business on the foundation of primary care. We added mental health solutions, we added PT and OT, and we've got occupational health solutions as well. We even have clients right now that are asking us to provide dental and vision, just really based on the results that we're driving and the money that we're saving them. So look, we'd love to be involved in more verticals beyond primary care, beyond mental health, beyond occupational health. That could come through acquisitions, could come through some strategic partnerships, but we want to be a total cost of care provider for the clients we serve and save them money, and eventually take on more and more risk. Right now, we take some upside and downside risk based on performance. We'd like to take even more risk. We have clients that reach out to us and say, hey, based on our own actuarial data, you've saved us $10 million over the last 5 years. And so it'd be nice to be in a position to participate in some of those savings. So we'd love to get to the point where we can even think about taking full cap eventually, and be a solution where we provide all the healthcare and tremendous savings for each of the clients that we serve.
So as you think about that diversification, are you thinking about M&A? What's your mindset when it comes to buy versus build?
Yeah, so look, we're looking at each vertical in a build by partner strategy. We've decided to build our own mental health solution, proprietary solution that's working quite well, and most of that is done virtually, and so that's a great solution for the clients and the patients. We're going to analyze that in other verticals like occupational health. We're open to that, but again, one of the reasons we raised $164 million recently was to be open to M&A, and I think the M&A for us will likely be focused on ancillary services beyond primary care.
Okay. Given your roots, originally a carve out from kidney care giant DaVita, an obvious place to expand, if I'm thinking about this, is kidney care. Could we see you do something there?
Yeah, I think for us, those would be partnerships, right? And so it's unlikely for us to own a kidney care vertical, but look, we are very intentional. Part of our cost savings are driven by where we send referrals, right? So we want to send referrals to the best value-based providers, and we're agnostic in terms of the systems where we send our referrals. We want to make sure they're in network for the clients that we're serving, but we want to make sure we're sending those referrals to the best value-based care providers. And so eventually, I think you'll see us partner and do some bundling with some of the specialty care providers in lots of different verticals, kidney care being one of them.
And talk to me about your customer base. Are you growing on the large corporation side? Will that put you into competition with One Medical?
Yeah, good question. So we are doing more and more in the Fortune 200, the Fortune 500 space. We now have a dedicated sales force that's focused on that target client. So we have announced a few big clients recently in the Fortune 200 space, and the reason that they really like to work with us is because we have size and scale across a number of different states. So those Fortune 200s typically have employees that are in a number of different states, and they love our ability to provide both in-person care and virtual care to them. So, like, I think you'll see us doing more and more of that. But again, we aren't focused on just the big urban geographies. We're focused more on blue collar America. So the types of clients that we're serving tend to have manufacturing plants in places that aren't located in big urban communities. So that's a sweet spot for us, and we want to continue to serve that population. Frankly, those are the patients that really need much better healthcare.
So you mentioned hybrid care. Let's dig in a little bit there. There was a big focus the last couple of years on, tech-centric companies, and it seems like we're kind of seeing the pendulum swing towards actual clinic networks and care providers. What's your point of view? How do you think about hybrid care?
Yeah, so we think hybrid care is essential to serving the whole health and providing the results that we provide. So we are being asked, Sarah, literally by every single one of our clients to provide both, to provide in-person care as well as virtual care. And so pre-pandemic, we had a single-digit number of our visits were done virtually. At the height of the pandemic, and gosh, I sure hope the height is behind us, but at the height of the pandemic, I think we had as many as 72% of our visits were being done virtually. We think that's going to level off somewhere between 25 and 30%, but that's still a heck of a lot more than we were serving before the pandemic. And what that means is that individuals, specifically the types of patients that we serve, have gotten more comfortable with conducting their visits on their phones and seeing their doctors on the phones. And frankly, these are individuals that may have chronic conditions, and these are perfect visits that can be handled through technology. And so these tend not to be early adopters in terms of the technology that they utilize. And so these individuals have gotten very comfortable with conducting their visits by phone and interacting with their doctors by phone. And so they want to be able to do that, but they also desperately want to come in and see their physicians too. Many individuals do want to do that on a regular basis, at least once a month for some of these conditions. So our clients are asking us to provide both, and we're doing both. We have our first virtual only clients, but they're asking us to eventually build in-person clinics too. So they eventually want to have both, but they're just starting with the virtual care.
So as you're building and opening up in new markets, working with new employers, what's your biggest bottleneck? What keeps you up at night?
Yeah, so it's all about the people and the providers, right? So we're only as good as the providers that we have on staff, and they're all full-time employees, but we're only as good as the care that they deliver to the patients and frankly to our clients, the results we deliver to our clients. We have a fairly, let's say, an easier time of recruiting than your typical fee-for-service providers, because our physicians are oftentimes coming from the fee-for-service world, where they're serving panel sizes of 2,500 to 3,000, and coming to Everside where their panel sizes are 800, 850 people. And they can then see patients for 30, 60, 90 minutes at a time, practice at the tops of their licenses, not spend as much of their time on coding and billing, because we charge the employer directly a PM fee. And then frankly, it's a better lifestyle for them too. They can serve patients, and then at the end of the day, go home and see their kids' soccer games, right? And so it's a better lifestyle for providers. But that said, we need to continue to educate providers, frankly, work with medical schools across the country and let them know that this model exists, because too often I continue to hear, as we're recruiting providers, they say, gosh, I've never heard of this, or this sounds too good to be true. And we really have to then introduce them to our providers that are already on staff to let them know what the experience is really like. So again, I think that's the bottleneck, is just our ability to continue to recruit great providers across the country.
So last time we spoke, Everside was approaching, I think, 400 health centers, 34 states. What will Everside look like 5 years from now, both from a scale perspective and offerings perspective?
Yeah, so I think I get back to the total cost of care, but we'll continue to grow and look, we expect to grow 25-30% organically year over year, and so add that many clinics. I certainly hope that in 5 years we'll have thousands of clinics and frankly be serving millions and millions and tens of millions of lives. And I'd like to be in all 50 states by 5 years. But I also really see us providing much more care beyond primary care mental health. So I think you'll see us make a big play in occupational health. Certainly PTOT, MSK, partnering with some of the specialty verticals that you mentioned earlier, kidney care being one of them, but lots of different ways for us to continue to grow. And again, we want to just make sure we're delivering great results to the patients that we serve and the clients that we serve. So I expect that that dollars saved amount to continue to increase and our NPS scores to continue to rise. It's just a better model. You've got, I think 82% of our patients have reported better health, and 99% of our doctors are reporting increased satisfaction for the patients they're serving. So look, we'd love to be providing this for as many Americans across the country. And look, there's also an opportunity for us to expand internationally. And there's a lot of lives to be served here in the US commercially, but I get inquiries all the time from different constituents in different countries about this model and wondering how we can bring it to their in their respective geographies.
Great. So you're sitting pretty comfortable in terms of a cash pile perspective, but what would your advice be for entrepreneurs listening in that are earlier on in their life cycle? What words of wisdom do you have for them to, it's a difficult fundraising environment right now.
Yeah, it is. It's a tough market out there. So, this is advice, frankly, that I give, Sarah, regardless of the market, but I always advise entrepreneurs to bootstrap as long as they possibly can before they bring on institutional capital. It's just a healthier way to grow a business. You end up retaining much more ownership. And I think it's a way for you to learn about the successes and failures of your respective businesses before you bring on institutional capital that's going to be influential in terms of how you run the company moving forward. And then I'd just be very careful and smart about the capital that you bring on and the partners that you bring on. I've been very lucky with my current round to have investors that have a long-term vision, right? So average hold times of 8-9 years. No one is being pressured to flip the company or do some things that may affect our growth and our future and the lives that we can impact. So I would be really intentional about bringing on long-term partners that have the same vision that you do. And that's oftentimes tough to do, but it can be done with a lot of diligence. Ask a lot of questions, talk to entrepreneurs that they've already funded, and get a real feel for how they operate.
So let's wrap up with kind of a fun one here. If you were running another value-based care company or primary care company that wasn't Everside, who would you want to be in charge of? Who do you believe in, thinks doing really super innovative things today, poised to be a long-term player?
Well, I guess I'll start by saying there were 3 companies I really liked in our existing space, and we acquired them, right? So we've acquired Activate Healthcare and Health Stats and Our Health, and those were great fits for us. They were providing great value-based care, and we were able to tuck them into Everside. But look, there's a lot of different companies out there that are providing value-based care. I have a lot of respect for them. There's a company, my CFO is on the board of a company called Signify that was just purchased by CVS, but they do great work, use great analytics, provide in-home care. I love their model. They're serving a senior population, and I've spent some time in my past serving the senior population, so that's near and dear too. So I'll give them a shout out because my CFO has direct ties with them. But look, I really applaud all the entrepreneurs and all the entities that are out there that are moving to the value-based care model because it's just such a differentiated model, and the results are pretty dramatic.
Awesome. Well, I think that's all we've got time for today. So I want to thank you, Chris. We really appreciate you taking the time to join us today.
Thank you for having me. My pleasure.
And now joining me for a Why It Matters segment with my colleague, Axios Pro editor, Claire Wichlewski. Hi, Claire.
Hi, Sarah. How are you?
Good. Thanks for joining. Would love to hear your quick take on what stood out in my conversation with Chris.
Yeah, thanks for having me. It was a great interview, very interesting. I think my ears definitely perked when Chris mentioned some of his customers and clients at Everside looking for them to provide dental and vision care. They're obviously already in mental health and OT, PT. So naturally, I thought about the bevy of sponsor-backed vision and dental platforms that are currently out in the market or will be coming to the block soon. You and I have talked a lot about, how big do these platforms get until they're a little bit too big to chew for private equity. So it's sort of an interesting idea that we now potentially have like a strategic acquirer in these value-based care players that are looking to diversify.
Yeah, that's a great point. And I guess going off of that, my takeaway also is that value-based care really started with primary care. And now we're starting to see more focus on the specialty care providers, whether that's kidney care or I guess dental, although I really haven't seen that yet. So it'll be interesting to your point and Chris's comment, how that works in areas like dental where we really haven't seen that kind of reimbursement structure traditionally.
Right. And, those specialty providers are attracted to private equity because of their ancillary services that they can bill for. So if the value-based care regime starts, impacting these specialty providers, that may impel investors to sort of think a little bit differently when they're growing those platforms. But either way, I think it'll be really interesting for like physician M&A for the next few months and years, certainly.
And I also am curious kind of, how you think about their competitive standpoint when so much of the conversation is around the public market peers like One Medical that now has a lot of firepower behind it with Amazon. To his point, he plays in a different end of the market, but obviously he's watching closely what all his peers are up to.
Yeah, and I mean, having the deep pockets of Amazon means you can go into markets that you weren't in before. I mean, they do present a very formidable competitor, certainly, and then it remains to be seen. Obviously, CVS has made its bet in the sort of home health space with Signify. They will very likely make a move in pure primary care. So you have these like very well capitalized competitors with strategic firepower behind them. You have to wonder, how that impacts Everside's timeline. I know Chris mentioned that they might return to a public market listing if the markets brighten a little bit. But yeah, it'll be interesting to see how they navigate this competitive landscape.
And something we'll probably see play out is kind of how do those that went public and those who stayed private, like an Everside, succeed? I mean, there's something to be said for not having the public market overhang where you can really act on your strategic initiatives and grow the way you want to grow. So we'll see how that evolves.
Right. And I mean, I think the Everside is watching what public investors care about, right? I mean, Chris mentioned like the focus is now on profitability. It's not on your revenue projections. It's not on, your prospective value. They want to see results. And we've seen in digital health, there's been a huge market correction because these companies couldn't grow into these lofty valuations. And you think about Cano that went public at a 4.4 billion valuation, something like that, through that SPAC that it merged with. I mean, how do you maintain that?
Yeah, very good question, and very excited to see how Cano plays out, which might be any day now. So that's all we've got time for, unfortunately. Thank you for joining us, Claire.
Thanks so much.
Thank you all for joining this afternoon for this Axios Pro event. Our newest news subscription, Axios Pro Policy, will launch next month. Join the waitlist at axios.com/pro/waitlist to unlock special launch pricing and to get an exclusive sneak peek. Thank you again for joining, and we'll see you on axios.pro.com.